we're going to be talking about how to remove an arterial line. Removing an arterial line is very similar to removing a peripheral IV with a couple other floofy steps in there. And of course, always make sure you're following your hospital's policy. We're going to be talking through the basics, but your hospital may have some variation of this procedure, and make sure you're following that. Before we remove an arterial line, we need to make sure that we're doing it, one, safely, and two, that we have a reason to remove it. For example, the provider has ordered it, maybe the line isn't working anymore, or your patient's gotten better and we don't need it anymore. We also should check your patient's coagulation labs to make sure that they don't have, a super high INR or super low platelets, and evaluate if your patient's on any blood thinners. And if they are, then always touch base with the provider to make sure that the type of blood thinner they're on shouldn't be any reason we cannot get the arterial line out. Once we've verified those things, we're going to gather all the supplies. Most hospitals just require this to be done aseptically, but some will require it to be done in a more sterile fashion. So definitely make sure you're looking at your policy. But I'll grab a transparent dressing, a couple 2x2 sterile gauze. I like to grab a chlorhexidine swab to clean the area, sterile scissors if there's any sutures, and then if you're doing it sterile gloves and a mask. I'll start by setting all my supplies up first, so that way everything's like readily available for me to grab. I also will bring the trash can close by, because when you remove this thing, it's hooked up to a pressure bag and some saline, and I like to just like kind of throw the whole thing into the trash. I'll go ahead, wash my hands, get my gloves, all my stuff's ready, and I will go ahead and remove this dressing. I like to use the chlorhexidine swab to remove it. That way it doesn't hurt the patient as much, but it's also simultaneously like cleaning the area and getting any securement device off. I'll also deflate the pressure bag, and right before I remove the arterial line, I will clamp the saline bag that's hooked up to the line, so that way when I remove it, it's not like spraying saline everywhere. But only clamp it right before removal, because if you clamp it and then let's say you get busy, you come back 10-15 minutes later, there's a chance that a thrombus could form in this line, and we don't want to form unnecessary thrombi. Once the dressing is all the way off and you're kind of just chilling here holding the line, I will take my sterile gauze and I will place it over the site and simultaneously remove the line and hold some good pressure over that artery. Arterial lines aren't that big, so you should be able to achieve hemostasis in like a 5 to 10 minute period. Once I've held manual pressure for a couple minutes and ensure that the bleeding has stopped, I will take a fresh, sterile 2x2 gauze and pop that on with my transparent dressing over the top. And then I will make sure I follow my hospital's policy for documenting and assessing the site. And just because something isn't externally bleeding, make sure that you're not forming a hematoma and keep a good eye on that site. Again, follow your hospital's policy for assessing and documenting afterwards. That's it. Let me know if you have any questions.